Good morning all. The topic of my presentation is irrigants and intracanal medicaments. Coming to its introduction, clinical endodontic encompassment of number of treatments, but they have been in common group, elimination of significant reduction of irrigants and prevention of right contamination of root canals after the treatment and the essential successful treatments of the regions are cleaning and shaping procedures as a part of root canal treatment are directed against the microbial changes to the root canal system. Also, the team cleaning and shaping are often used to describe the root canal treatment procedure, reversing the order to shape and cleaning more. Mechanical objective should be complete and centered in incorporation of original canals into the prepared shape. Biological objective is to run the disinfectant optimally through the removal of infected pulp dentina. Irrigants can enhance the mechanical debridement of the slides. Classification of irrigants: chlorine releasing irrigants, oxidizing agents, chelating agents, organic acids, herbal irrigants, endodontic irrigants, chemical, natural, tissue dissolving agent, antibacterial agent, chelating agent, combination and production of the reagents, antimicrobial agents, NaOCl, bactericidal, herb, ADDA, MTADA, Qmix, and training of the reagents. According to the stock, it is chemically inactive, chemically active, saline, and acid range of the reagents. Ideal requirements and function of irrigants. An ideal the irrigant should be effective germicide and fungicide, non-irritant to the pulp tissues, remain stable in solution, active in presence of blood, serum, protein, and the derivatives of the tissue, low surface tension, not induce the brain immune responses, completely remove the smell, disinfect of the dentin and the tubules, no adverse effect of physical properties of exposed dentin, removal of particular debris and wetting of canal, destruction of microorganisms. In the endodontic irrigants, which includes normal saline 0.9% solution, since it is biodegradable, no adverse reaction can be seen when even it is extruded periapically. Sodium hypochlorite, NaOCl, main irrigant of choice during root canal treatment, with the concentration employed engaged between 0.5% and 6% of the reagents. Mode of action: when it comes in contact with the tissue protein, nitrogen formaldehyd form peptide links of proteins or fragment during disintegration, permanent hydrogen in amino group to be replaced by choline forming reagents. Extract et al. Has proved hypochlorite formations of the reagent. Hypochlorous formations are tissue dissolving action of NaOCl estimated to be 20 minutes to 2 hours, and the Grossman et al. Holmes et al. Has also assessment percentage 5.25% for 5 minutes, under 2.5% for 10 minutes, 1% for 20 minutes, 0.5% for 30 minutes. Method to increase the efficiency: temperature, tissue dissolution capacity of NaOCl is directly proportional to increases in temperature. Concentration: high concentration of NaOCl is better tissue dissolving properties. However, controversy is during the clinical studies, staining the lower concentration in high volumes of the reagents. Hasbro et al. And Mogo et al. Concluded the presence of dentin caused a marked delay in killing of E. fecalis by 1% of NaOCl. Hence, there is conflicting evidence regarding the time course, since the in vitro studies often have dentin in cultural use. However, in clinical conditions, there is a presence of organic matter consumes of the reagents. And even though there is a high concentration have been associated with the improved treatment outcome, the level of evidence is weak. However, the contradictory results have been reported when lower NaOCl concentrations are applied. Chlorhexidine was first developed in 1940. There is a strong base and most suitable polychloride. Chlorhexidine is the most potent antiseptic which is widely used for chemical plaque control in oral cavity. Aqueous solution of 0.1 to 0.2% are recommended for the purpose, while 2% is concentration of root canal irrigating solution. As with the sodium hypochlorite, heating of chlorhexidine irrigant, the lesser concentration could increase the local efficiency root canal system. Mode of action: high concentration is act as a bactericidal by damaging the cell membrane, and the precipitation of cytoplasm will act as a detergent. In low concentration, it acts as a substantivity. It shows residual antimicrobial effects for 72 hours. It binds to the hot tissues. Despite of usefulness as a final irrigant, cannot be advocated as a main irrigant in standard endodontic cause, as it is unable to dissolve the necrotic remnants of the reagent. H2O2 is widely used biocide for disinfection and sterilization. It is clear, odorless liquid, mainly used in 3% concentration as an irrigant. It is active against virus, bacteria, yeast, and even base resin. Mode of action: easily decompresses and readily dissociates with the water and nascent oxygen. It acts by oxidizing bacterial sulfonate group of enzymes and interface with the bacterial metabolism. Rapid release of nascent oxygen results in effectiveness effect, which is through the aid of metabolic debridement. Urea and urea peroxide is a white odorless crystalline powder initially used for its therapeutic effect. It is readily soluble in water or alcohol and glycerin. It is a mild solvent of necrotic tissue pus, and it is mild antiseptic. In 1951, Belchman and Cogan suggested that 30% of urea can be used as an irrigant. 10% of urea peroxide dissociate more slowly when compared to that of hydrogen peroxide, so as effectiveness is prolonged but not pronounced. Mode of action of urea: it's act by destroying the bond of secondary structures in protein, especially making the protein lose its functionality. It is also soften the fibrin molecules, which is responsible for its debriding activity. Mode of action of urea peroxide: decomposes rapidly into urea and hydrogen peroxide, combining the effects of both. Anhydrous glycerol increase the stability of the solution. In certain cases, its antibacterial presence. Ethylene diamine tetraacetic acid, it is most commonly used chelating agent used by Nicot osbetre as an irrigant. It is relatively non-toxic of the reagents. Mode of action, different forms which is available. Citric acid, which is not highly used nowadays. Hydrogen peroxide bisphenol, H is HEBB. Presence as a bone resorption used systematically in patients suffering from osteoporosis or Paget disease. Salmeazole, quaternary ammonium compound, and the iodine potassium used in concentration of 2 to 5 percentages of the region, although it shows a promising results against the region. Natural irrigants such as neem, tulasi, and the regards the biological effect of neem is mainly due to its regions, which is now called photobiotic region. Green tea is a rich source of polyphenol, but it is a new irrigating solution, electrically activated solution. Lenovo in 1997 has been produced. Main the advantage is non-toxic to the biological tissues, water or low concentration, electrochemical treatment, analyte solution, catalytic solutions of the regions are ozonated water irrigation solution. It is shown to be powerful antimicrobial agent against bacteria, fungi, protozoan, and virus. It was reported that the ozone at low concentration is sufficient to inactive bacterial cells, indicating the spores are. Nygaard found the killing ability of ozonated water of the reagent. Total solution introduced by Dr. Clifford Adels. It is an experimental irrigating solution to visualize the microanatomy of the root canal system. Mode of action, combined effects of NaOCl, EDTA, and HAPAC helps to visualize the shape and the microanatomy of the canals and dentin thickness during endodontic therapy. So it can be helpful for improving the diagnostic accuracy, treatment planning, management of protocol accidents, but further studies are needed to prove its effective against the irrigating solution. Mixture of tetracycline acids and MTAD of the reagents, tetracycline or doxycycline of the reagents. Qmix, it was introduced by solution for smear layer removal of antimicrobial efficiency, comprised of EDTA, CHS, a detergent, and deoxyrized water. Designed finally again to replace 70% of EDTA final wash. It is known for its penetrable biofilms, have less effect of demineralization. Photo-activated disinfection, it was fast, effective, and minimally effective, low percentage of the light. Photodynamic therapy or light activated therapy of the resin. Ultraviolet light disinfection. Ultraviolet light is widely used for disinfection purpose. ADA studies have given promising results. Midnight is used as additional procedure of the resin. Photo-initiated photoacoustic streaming, plastic surgery of the different and the sizes, brushes and the which is the dynamic endodontic brush is spiral brush of the region, manual dynamic irrigation system. Research shows the 2 to 3 mm of the strokes of the region. Several factors have been contributed to the positive results of the manual dynamic findings. The rattle brush arrow and the rotary handpiece attached to the micro brush has been used to facilitate the debris and smear layer removal for instrumental root canals of the region. Endovac system is an apical negative pressure irrigation system composed of three basic components: a master delivery tip and the macro cannula and the micro cannula. MDDAD delivers irrigants to the pulp chambers. They evacuate the irrigants continuously. Both the micro and macro cannula are connected via tubing to the syringe and a high-speed section of the dental unit. The macro cannula is used in the section of the middle segment of the cannula. The micro cannula are also used in the multivated needle with external diameter of the regions. Positive pressure versus apical pressure, and the first experimental use of pressure alteration irrigation technique was non-instrumental technology invented by Lucy et al. In 1993. This technique did not enlarge the root canals because there was no mechanical instrumentation of the root canals. Although it was a unique and successful in vitro, the technique was not considered safe. Hereby, I conclude that the elimination of bacteria from the root canal system plays a major role and critical role in success of the treatment. Tissue debridement depending on treatment physiology and removal of smear layer. Thank you. These are my references.